Hi, I'm Annette from Dental Designs, and if you've ever had a toothache, especially in the back of your teeth and the molars, then you'll know how uncomfortable that can be. Today I'm here to explain what that cause of the pain might be and how you can manage it. First, let's talk about cavities. It's one of the most common reasons for a toothache. Dental cavities happen when the bacteria in your mouth break down the food and sugars, creating an acid that damage the teeth structures. Molars can be more prone to trapping this bacteria because of their unique shape, but also due to the position in the mouth where they're further back and it's harder to brush them. Over time, the cavity can lead to increased sensitivity to hot and cold things, pain on biting, and also throbbing pain. These cavities can be restored with fillings if they're small, but if they're too big, then they'll need a crown. So if it's left untreated, the cavities get deeper and deeper and potentially reaching the nerve of the tooth. You may require a root canal treatment or an extraction if the tooth is too severely damaged. Next, we'll talk about gum disease. Gum disease or periodontal disease can be another cause for pain in the molars. When bacteria or plaque build up at the gum line, it leads to gum inflammation. And over time, this inflammation causes gum recession, bone loss, and even shaky teeth. When there's severe inflammation, you can also feel kind of a persistent ache around the teeth, pain on biting, and bleeding from the gums. To resolve the inflammation, removal of the bacteria deposits is key, so scaling and polishing is essential in managing this. There are some times where local anesthetic may be required so that patients can feel more comfortable, especially if the inflammation is severe. Other times, gum surgery might be required. Another possible cause of molar pain is a tooth abscess. Tooth abscess is a painful infection that develops at the root of the tooth and it can spread through the gums. This can happen if a cavity is left untreated or if there's trauma to the teeth. You'll often feel like a dull throbbing pain and even a swelling at the gums. If you do suspect that you have a tooth abscess, it's essential to get treatment early because it needs to be managed by either draining the infection or starting a root canal procedure. So early management is key, especially with dealing with a tooth abscess, just to make sure that we can control the infection and prevent spread to other areas. Now let's talk about cracked teeth, which is another very common reason for molar toothache. Teeth can crack for a variety of reasons. First is if you're biting on hard foods, if you have a trauma to the tooth, or if you have any clenching or grinding habits. When a tooth cracks, it can lead to sharp, intermittent pain, especially when you're biting or chewing on things. Cracks can sometimes be very small and not visible to the naked eye, but it can still lead to significant sharp shooting pain when you're biting down. If the crack is deep and potentially reaching the nerve of the tooth, the symptoms can be even more severe. I think it's also important to identify the likely contributing factor to the cracked teeth and then act preventatively to protect your other teeth as well. This may include changing some dietary habits like avoiding hard foods and wearing a mouthguard during the nighttime to protect against clenching and grinding. And finally, let's not forget your wisdom teeth. So your wisdom teeth are your third molars and they usually only emerge after your late teens or early 20s. It can run into issues if your wisdom tooth is not able to erupt fully due to an obstruction. This is what we call an impacted wisdom tooth, and oftentimes it leads to food getting stuck around the tooth, and it can cause further cavities, gum inflammation, or swelling. There you have it. I hope this video helps to explain what the possible causes of toothaches might be. If you're experiencing any of these symptoms, I would suggest getting a thorough checkup and getting treatment early. If you have any further questions, please feel free to contact us here at Dental Designs. Thanks for watching. See you!